Good morning. Welcome to Raya's Paradise. This is Dementia Training. My name is Monica Westphal and I am your Chief Operating Officer. These are the table of contents and things we're going to review today. Communicating with people with dementia, what is memory loss, abuse with persons with dementia, fall risk and prevention, hospice care, living with grief, managing difficult behaviors, normalization, pain assessment in advanced dementia patients, the progression of dementia, reasons challenging behaviors occur with dementia, redirection techniques, and risk factors that increase challenging behaviors. Let's get started. Communicating with people with dementia. Communication is the exchange of information between two or more people. Communication involves talking or writing as well as listening and responding. Communication is more than simply just sending a message. Communication is sharing of information and ideas. Good communication is important to help achieve goals, to understand others, learn new information, and build teamwork. Communication involves both the spoken word and nonverbal message, the emotions of people involved, the cultural background of people involved, this affecting the understanding of the message. Listening is the most important skill. Active listening is the ability to completely focus on other persons as he or she speaks. Active listening is needed to understand all three of the meaning of communication: verbal and nonverbal messages, the emotions behind the message, an example, pain, and cultural background of the speaker. To do active listening, you must do the following. Don't interrupt the person when speaking. Listen to all the information before interrupting the message. Understand that the first few words spoken may not be the message it's being delivered. Do not judge the message. Try to understand the other person's thinking. It's okay not to agree with the other person, but try to understand what that person is saying. Active listening means stop what you're doing, focus on what's being said, stay calm, think about the feelings of the other person, and only speak the other person has completely finished speaking. I will pause a few minutes here and talk a little bit to you about what active listening means. As this slide indicates, you need to focus on what is being said and you need to stay calm. When you're dealing with residents with dementia, always keep in mind they don't always comprehend what you're trying to communicate or vice versa. So it's very important that you stop what you're doing, not be on your phone, not be distracted while talking to another associate, and pay attention to what the resident is trying to communicate. This will avoid and prevent potential behaviors. Active listening does not mean doing something else while the person is talking, thinking about what you will say, being upset or defensive, reacting to what you think you heard, offering suggestions or advice unless asked. Again, while if you're on your phone and you're doing something different, the resident will get upset. If the resident is being aggressive with you and yelling at you and you are already thinking about what you're going to respond, it's not going to be a good outcome. Always make sure you listen to everything the resident is trying to communicate. Nonverbal communication. As the person with dementia loses the ability to use meaningful words and to understand communication, he or she will be able to understand the feelings of others. Body language is the set of behaviors that tells the message without words. Nonverbal communication is more accurate and believable than the spoken word. Body language and nonverbal gestures become more important than words as dementia progresses. The person with dementia will pick up on anxiety, fear, happiness of the people around them. Nonverbal indicators include eye contact. In America, eye contact is expected, but in some cultures, direct eye contact is considered disrespectful. Look directly at the person speaking. Making eye contact shows the person you are interested in the information. Starting shows anger or domination. Avoiding eye contact shows guilt or submission. Looking down shows shame. Posture. Standing over someone that is sitting makes that person feel threatened. Sit next to the person sitting and lean forward. When both people are standing, stand straight, lean forward. That tells the person you are interested in what he or she is saying. Gestures. Gestures to add what is being said. This is important for people with dementia who are having difficulty understanding directions. For example, patting the chair helps the person understand that you want to sit. Holding up a brush reminds the person about brushing hair. A clenched fist means anger. A pointed finger can mean blame or dominance. Fidgeting hands can show nervousness. Folded arms across the chest may show disinterest. Looking away may show boredom. Positive gestures. Nodding the head indicates that you are listening and may even be agreeing with what is being said. Smiling shows interest. Having open arms and leaning slightly forward. All of these are positive gestures. Your facial expression. Smiling and making eye contact shows interest. A furrowed brow, wrinkled forehead shows worry. Frown may mean anger or not agreeing with what the person is saying. Make sure the expression on your face matches how you're feeling. Do not smile if you're angry. Your tone of voice. What we say can be changed by how our voice sounds. The qualities include the pitch, how high or low, the speed, the volume, how loud or soft, and the articulation, how clear. When people are angry, annoyed, distracted, anxious, or in a hurry, the tone of voice changes. The pitch may get higher when the person is surprised or anxious. The volume changes when the person is angry or annoyed. The speech may be choppy or rapid when angry or anxious. The speech may be slow or halted when the person is bored or distracted. Memory loss and communication. Now let's talk about short-term memory and long-term memory. Short-term memory definition is, this is the recent memory within the last 2 years. This is the first memory loss in dementia. Long-term memory is all events and information that a person has learned over his or her lifetime. Dementia destroys the long-term memories later in the disease process than short-term memory. I'll go a little in depth with short-term and long-term. Short-term memory is basically when a resident cannot remember what they had for breakfast and or lunch. In other words, you may come in the morning, feed the resident, give them their breakfast, and about a half hour later, they're telling you they never had breakfast. This is the diagnosis of short-term memory, things that residents can't remember that happened within the last 2 hours. Long-term memory are more of their long-term memories from when they were children, perhaps their family members, who their actually grandchildren are, and where they lived. So if the resident is indicating to you that they don't remember where they live, where they were born, who their family members are, then they suffer from long-term memory. Again, short-term memory is within 2 to 3 hours of a time span, and long-term memory is more lifetime events. Let's talk about the communication with early stage of dementia. So early stage is going to be forgetful of current or recent activities. The person may use one word in the sentence incorrectly and be upset when no one understands. The person may forget names of people that they have not seen frequently. For example, the person might say, "I want to go to the plant." The associate can't tell if the person wants to go outside, wants to work in the garden, or wants to go on an outing. Communication with middle stage of dementia. Both speaking and understanding become more difficult. Speech often makes no sense. For example, the spoon is helping the dog. Is this person talking about eating, the dog, or needing help with something? The person will have trouble remembering who the person or person's name. Even close family members may be forgotten. The person will have trouble naming objects. Let's talk about communication with late stages of dementia. Here you have severe language breakdown. Most people have only 1 or 2 word vocabulary. Both severe long-term and short-term memory loss has occurred. Difficulty making needs known and understanding speech will be common. The person may not speak at all. Perhaps they may be mute. The activity the person is doing is in their communication. For example, if the person is banging on the door, he or she's trying to communicate that he wants to go outside. This is all the late stages of dementia. Problems people have with experiencing in communication when they have dementia. Number 1, word finding. The person often knows that he or she's trying to stay but can't find the correct word. Delay in responding. Person may need additional time when responding to a question or comment. 3, repeat words and phrases. The person sometimes gets stuck and repeats the same information over and over. Certain phrases are often heard by residents, such as, "I want to go home." Don't argue with the person about going home. Instead, ask questions about his or her home, and the parent. Where do you live? Again, look for meaning behind the words. If the person is afraid, bored, or lonely. Let me talk to you a little bit about, "I want to go home." This is a common phrase that you will hear residents talk about. Oftentimes, they're referring to the home they had as a child, not the home they're living in. It might be a new setting, and all they're telling you is, "I want to go home." The easiest thing to do is try to redirect. As I indicate here, don't argue with the resident. It's best if you just reassure them, have a staff member help you, and let them know that you will make arrangements for them to go home, but right now, this is the safest place for them to be at. Number 4, insisting about a certain topic. The person can't get a certain idea or thought out of his mind. For example, the person may insist that he needs to go to school. Number 5, using words unrelated to each other. The person is trying to communicate, but no meaningful sense can be made from the words. Act as if you understand the message. Smile and respond back. Always look for clues to try and figure out what the person is attempting to say. Now let's talk about nonverbal communication. Observe the person and look at the facial expression and eyes for understanding what the person's mood is. Use visual cueing with the words, such as patting the chair as you want to tell the person to please sit down, or hold up the hairbrush and explain that you will brush their hair. Use touch more frequently. A hug or a pat on the shoulder or holding a person's hand shows the person that he or she is important and loved. Now let's talk about categories of dementia. We have reversible and irreversible. Reversible dementia. This dementia is temporary if treated. These can be reversed or cured. The most common causes for reversible dementias are depression, medication, infection, malnutrition, congestive heart failures, and an injury from a fall. Irreversible these are caused by medical condition or disease. These cause permanent brain damage. They have no cure. They will be terminal. The most common types of irreversible dementias are Alzheimer's disease, vascular dementia, Parkinson's disease, and Lewy body dementia. Alzheimer's disease is the most common type of dementia. Alzheimer's disease is a form of dementia. The Alzheimer's Association defines Alzheimer's disease as an irreversible progressive brain disease that destroys memory, thinking skills, and eventually even the ability to carry out the simplest tasks. Today, a PET scan special X-ray can find that plaques and tangles that are used to diagnose Alzheimer's disease. Alzheimer's disease is not a normal part of aging. It's not contagious. It's not something you get from aluminum pots or deodorants, and it's not curable. Alzheimer's disease specific symptoms. Memory loss occurs first with Alzheimer's. You have short-term memory. What the person had for breakfast is affected first. The mood changes occur. The person may cry more frequently and no reason to be angry. The person may become anxious and fearful or combative with care. Paranoia and delusions often occur. The person believes that people are stealing personal items. Physical symptoms as the disease gets worse: difficulty walking, falling, balance problems. Now let's talk about vascular dementia. This is the second most common type of dementia. Vascular dementia is caused by problems with the circulation of the blood inside the brain. A blood clot may develop or bleeding may occur in the brain. The bleeding and blood clots may be from high blood pressure, high cholesterol, or poorly controlled diabetes. Untreated high blood pressure causes 60% of vascular dementia. African Americans are 4 times more likely to suffer a stroke due to high blood pressure than Caucasians. What are some of the symptoms of vascular dementia? We have sudden changes such as dizziness, weakness on one side of the body, speech problems. Remain stable for a long period of time until another stroke occurs. No personality changes as seen in the Alzheimer's disease, and the judgment is unusually affected. Vascular dementia, again, is related to mostly high blood pressure and those people who have strokes. Let's talk about Lewy body dementia. So 15 to 25% of dementia is Lewy body. The average onset is between 55 and 65. Death occurs 5 to 7 years after onset. Lewy body dementia was first discovered in 1970. It was thought to be rare. Abnormal cells called Lewy body develop on the outer layer of the brain. These are the symptoms to Lewy body: difficulty walking, shuffling gait, tremors, rigid posture, neck is down. Visual hallucinations. Up to 80% of people with Lewy body have these. Day-to-day changes in symptoms. One day very confused, the next day they're very aware. Memory loss and poor judgment occur later in the disease. Physically, these people look like Parkinson's patients. Let's talk about Parkinson's disease. This strikes 120 to 180 per 100,000 people. The average onset is 50. Symptoms of Parkinson's. The first symptoms are tremors, slow movements, rigidity, stiffness, and poor balance. Memory loss and the inability to care for oneself occurs later in the disease, and this affects Caucasians the most. Huntington's disease. This strikes 1 in 10,000 people. The average onset is 30 to 45 years. Death occurs 10 to 20 years later. Huntington's was named after Dr. George Huntington, who discovered this in 1872. That was the nerve cells waste away and die in the brain. This develops at a young age, mid-30 to early 40s. Incurable progressive genetic brain disorder. Everyone who has this has a gene for this disease will die. Again, Huntington's disease is genetic. These are the symptoms for Huntington's disease: uncontrolled jerky movements of the arms, legs, and head, slurred speech, unsteady slow gait, facial movements, and head turning to shift eye position. Let's talk about Pick's disease. This strikes 1 in 100,000 people. The average onset is 40 to 60 years. Death occurs 2 to 12 years later. Pick's disease was named after Dr. Arnold Pick, who found the unusual cell in 1892. This disease affects the frontal lobe of the brain first. Unusual cells called Pick's cells are found with dementia. These are the symptoms of Pick's disease: loss of impulse control, say and do things that are rude, overeat and overdrink. The person will grab anything and stuff it into his or her mouth. Loss of inhibition, undressing in public, attempting sexual acts with strangers, Language problems, word finding difficulty, speaking difficulty. Memory loss comes later in the disease. These are the types of dementia that we went over: Alzheimer's disease, dementia with Lewy body, vascular dementia, frontal temporal lobe dementia, Parkinson's disease, Huntington's disease, and you have some other ones here: mixed dementia, post-operative cognitive dysfunction, and then traumatic brain injury. Let's take a break and we will continue our training.